Hello, I'm a level 1 nursing student. I'm wondering if I could follow you as you take care of Marta Yarn.
Oh yeah, definitely. Would you like a report on her?
Yes.
She's a 80-year-old lady. She came to us from the physician's office because she has a non-healing sacral ulcer. For about 3 months now, she's had it. The patient's been treated as an outpatient without success. But now she's admitted to us. As far as the wound goes, it's serous exudate. There's no unusual odor. It's about 4 centimeters in length and width, and then about 1 centimeter in depth. It's not too bad yet. We should be she's also on a regular diet. She's up with a walker, but you should probably still be standby assist with her because we don't want her to fall. She doesn't have any allergies. She is a full code. She weighs approximately 175 pounds, so she's slightly obese. She's in room number 529. Last time she was admitted into the hospital was 6 months ago. Also, she does not smoke. She has no history of smoking or heart disease or chronic illness. She lives alone in a senior housing apartment. She complains of a little bit of generalized weakness. She does have a little bit of weakness in the legs, so that's why she uses the walker, and again, why you should be the standby assist with her. Another thing is she denies numbness beyond her sacral area, so there's no numbness, but there's some weakness. She is slightly hard of hearing. She does have a little limited visual activity. She's got some glasses at bedside, so if she can't see or something, just make yourself closer to her, make sure there's plenty of light if she gets up. She has no nasal problems, and she doesn't have any kind of like a sore throat. There's been no change in vision since she's come to the hospital. She's had multiple admissions in the past for pneumonia in the past 6 months. She isn't really required any long-term therapy in the past, or just really situations. Her chest expansions are symmetrical. Her chest sounds are clear on auscultation and in all fields. Her abdominal sounds are present and they're normal. And she denies chest pain, palpitations. She denies that as well. She has no shortness of breath. She's sinus rhythm, occasional premature brails, but nothing really significant. She does, however, complain of occasional stress incontinence with nocturia. So we've been putting on a brief on her at night just in case she's unable to wake up and let us know that she needs to go to the restroom. She verbalizes low appetite. And again, like I said, her abdominal areas were present when it came to auscultating 4 quadrants for sounds regular. She's also taking gentamicin, approximately 80 milligrams, because she does have some E. coli that was tested positive in that sacral wound. So we are going to be giving her that type of medication to treat it. We're actually going to give an IV piggyback, and I'm going to show you how we're going to do that. Being a level 1 student, you've probably never seen that before. And we're going to piggyback it with 0.9 normal saline sodium chloride potassium chloride, I'm sorry.
So, why is this client receiving this medication, and what effect does it have on the body?
Well, it's going to inhibit the protein synthesis of the E. coli bacteria, because that's what E. coli is. I'm guessing, as bad as it sounds, she probably got some feces on the wound area, and now it's infected. So we're going to give that medication to prevent the little microbugs from being able to survive in that environment.
When should you question administering the medication, and does it have a therapeutic serum level?
It does have a therapeutic serum level. It's going to be 2 to 2.5 milligrams per kilogram. And I would question giving the medication if the patient has allergies to the medication, if she has irregular labs that indicate that she shouldn't be receiving this medication, or if her vital signs are inappropriate to receive this medication.
And what vital signs must be monitored?
I would monitor her respirations as well as her heart rate, blood pressure, and I would actually also monitor her temperature. You don't want you want to make sure that the infection isn't worsening. An infection can be indicative if there's a high fever, so we want to make sure to monitor that as well. Also, if she starts to have some side effects of this medication, like diarrhea, it's not a vital sign, but I'd still monitor it.
Which physiological parameters should be monitored when the medication is being administered?
Again, like you asked me before, vital signs are definitely something that you should monitor. The patient's overall appearance, you want to assess for signs and symptoms of superinfection. What you know what a superinfection is, correct, student?
Yeah.
Okay. So you want to assess for signs and symptoms of a superinfection, fever, upper respiratory tract infection, and stuff like that. We also want to monitor the intake and output. You want to make sure she doesn't get any dehydrated, and a really big thing that we're going to be monitoring very closely is going to be her white blood cell count. We want to make sure that that doesn't increase, because if it is increasing, then that means that the infection is getting worse and our medicine isn't working. We need to reevaluate.
And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to make sure that the patient understands that the person administering the medication to them is using the 5 R's, which is the right patient, right time, right medication, right route, and right dosage. You also want to make sure, or the patient wants to make sure that the patient is having at least a nurse or a physician administer the medication, and not someone who isn't trained to do that. Also, they should probably make sure that the person administering the medication is wearing gloves, washing their hands, using clean techniques, stuff like that.
And what about taking the medication safely at home?
Well, with this type of medication, it's very important that you follow its therapeutic regimen. If you don't really follow through with the medication all the way to the end, you're not really going to reap the best aspects of it. A lot of people, they go home with this medication, they'll only take half of it, they'll feel better, and then they stop taking it, and the next thing you know, when they get sick again, they're prescribed this same type of medication, except it's not as strong anymore because the bacteria is now resistant to this medication.
And what are the side effects and potential adverse reactions?
Some of the side effects are going to be vertigo, ototoxicity, hypersensitivity, as well as nephrotoxicity, and a superinfection could occur with this type of medication.
And how will you know the medication is effective?
Well, you'll know the medication is effective when we start to see our white blood cell count go back down to more of a therapeutic range. She will test positive or test negative for E. coli cultures on the sacral area, and you'll have resolutions of the signs and symptoms of the infection.
Alright, I think that's everything.
Alright, cool. So let's go in there and say hello to her. Good evening, dear.
Hello.
Can you tell me your first and last name, please?
Marta Yarn.
Alright, Marta. My name's Chris. I'm going to be your nurse today.
Alright.
Now, the medication I'm going to be giving you, it's called gentamicin. You're going to be getting 80 milligrams of it. And I'm going to give it IV piggyback, okay? Do you have any questions about that? Do you have any pain right now?
No.
No pain whatsoever? No? Okay, now, you do have a right to refuse this medication. Do you know that?
Yeah.
Okay, but you know that you need this, right?
Yeah.
Alright, so we're going to give it to you. Did you have anything nice for breakfast?
Just some scrambled
Some
eggs.
scrambled eggs? Not much of an appetite I saw earlier.
No.
No. Okay. I'm gonna go. Let's get your medicine ready.
Oh.
Anything interesting on TV today?
Just the news.
Oh, that's always interesting. Can I see your wristband, please? Thank you. Okay, so this is our normal saline. We're going to hang it first. Make sure the expiration date's good. Yes, it is. Make sure we're clamped. Clamped. Now what I'm just going to do is pour out a little of the medicine, make sure that we don't have any air in the line. Good. Gonna get an alcohol swab. Swab off the area here. And then connect. Good. Can I see your wristband? Okay. Guardrails. We're gonna do guardrails. IV fluid. 2.9 saline. Now we're doing that one right there. And the rate that we're gonna be doing it is at oh. Over. Check my paper here. Yeah, 950. Okay, start. We need to unclamp. Make sure everything's running smoothly first before we start our piggyback. That seems to be. Now I got air in the line. That should do it. Good. Now it's time to get piggyback ready. And one more time. Scan. Span first. Expiration date's good. Make sure we're clamped. Spike it. And then I want to hang this higher than I do the the potassium chloride, because I don't want it to draw from here. I want the medicine coming from here first.
Okay.
And take an alcohol swab. Wipe off the hub here. And then I'm going to back prime it. Alright. Now, channel select. Secondary, and it starts on gentamicin. We're gonna get it once daily, and it's 80 milligrams. Volume is 100. Patient weight is 80.
How to increase that by eating protein. So you want to intake lean meats, chicken, and any nuts that contain proteins, and also refer you to a dietitian.
Alright, so now the gentamicin is running, and then we're going to let that run for till it runs dry, actually.
Like I said, I'll put the coming here.
And there we go.
Is there any questions that you have for me?
Do you have any other questions while I'm here?
No, I think that's it.
Is there anything else I can do for you while I'm here?
No, I think that's it.
Alright, well, I know you were asking earlier when I told you we were going to be starting on this medication, you could have some information on it. So I did go ahead and I printed out some information in regards to that medication. There you go.
Thank you.
And I'll be back in a little bit to see if that medicine's almost done.
All right. So, were there any pertinent pieces of information you reviewed before administering the client the
I
medication?
want to make sure that the client isn't allergic to the medication. I want to check the doctor's orders on how to administer the medication. Obviously the 5 R's, making sure it's the right medication, the right patient, the right time, route, dosage, all that good stuff. And also, I had my patient care tech check the vital signs before we went in to make sure that we have a baseline starting.
And did this information affect how your decision to administer the medication?
This time it didn't, but if nothing lined up with the physician orders or something was out of whack, if her vital signs were, if she had a really bad fever, if anything was irregular, I definitely would have held the medication, especially if she had an allergy to the medication.
Did this information affect how you administered the medication?
It did, because the order was for IV piggyback with potassium chloride, and that's how I administered it. And it wanted to be administered intravenously, so I did that. And the dosage affected how much I administered, so I followed the doctor's orders on that one.
Alright, that's everything. Thank
Okay,
you.
Thank you.